Is in Dr. Marova. We're talking HIV. We're talking pretty much everything surrounding the topic of HIV. Off air, yes, go on.
Oh no, sorry. Do send through your messages on 0772168045 if you have any questions to ask. Doc, before we went to the headlines, we were talking about CD4 count. So there's someone who just sent through a message and said, "What does CD4 undetected mean? Does this mean HIV can't be transmitted?"
Okay, it's like they read our minds. Off air,
that's where you're. Yeah,
let's talk about this
undetected.
CD4
Good question there, but let me just correct this listener. The CD4 count, we don't talk about undetectable, we talk about the CD4 count.
Okay.
So there is a sibling to CD4, which is the viral load. So we talk about the CD4 count, we talk about viral load. So viral load, we are now saying the number of the HIV viral copies per meal. So that's the viral load. So viral load now that are there in the system. So when we start you on treatment, the HIV is going to be suppressing the viral load. So our target is for the viral load to be very low, to be very suppressed until it becomes undetectable. So when the viral load is undetectable, we want the viral load to be very low, and we want the CD4 count to be high.
Right.
Because when the CD4 count is high, you're saying your immune system is very strong.
Okay.
But when the viral load is suppressed, it means that we are winning this war against the enemy, which is the HIV. So our target is for the viral load to be undetectable. And when the viral load is undetectable, it does not mean that you no longer have HIV.
Right.
The HIV is there, but it's now controlled.
Can you infect somebody else?
Yeah.
With a low
viral load.
Yeah.
When the viral load is undetectable, Noxie, the chances of transmission are very, very, very low.
But that being said, people should still practice safe
sex, be responsible, don't be reckless. That is why nowadays it's also possible, Noxie, for a mother who is HIV positive to give birth to a baby who's HIV negative. Because if a viral load is suppressed, it also helps to protect the unborn baby. That is why also, Noxie, you can have a partner who's HIV positive while yourself you're HIV negative.
You know, thank you for bringing that up. How does it work in such a setting? So does the other partner have to go on, what's it, PrEP?
PrEP.
Yes.
So if we call these dishonest couples. So if the other partner is positive, the other is negative, we'll give the negative partner PrEP, so that we prevent the negative part by giving them PrEP.
And do you have to continue using PrEP for your whole life as long as you are a partner to this HIV positive partner?
Yes.
It doesn't affect you.
You know, Nox, there is always
side effects and stuff.
Every drug has potential side effects. Even if you're hypertensive and effectively it can still have side effects. But we always try to weigh the benefits and the risk.
Alright, there's an interesting question that just came through. Is it true that there are people whose immune system just doesn't get the virus? Listen, we're asking.
You know what? It's difficult to agree to it on air, but we have heard about such people, especially there is a certain tribe in Western Africa. And those guys, Nox, they have been noted to be very promiscuous, but they never get HIV. I don't know what happens with their genetic makeup.
Responsible.
All right. So there's another message that just came in. Anzi morning coach, unogona kubaiwa, and then orega kutorama pills. Do we have that here?
We have registered a drug that we call cabotegravir that we are now using to prevent HIV. So you can get that. You can get that once every month or every 3 months.
So it's available in Zimbabwe.
It's now registered. It's now available. It's for prevention of HIV. But
Not
necessarily for treatment. We are not yet using it for treatment, but for prevention.
Okay.
Oh, okay.
All right. Dedicated HIV, and no one else will ever get infected.
We have done so as a country. There is what we call 95. We are saying 95% of the population needs to know their statuses. 95% of the people that are positive need to go on treatment, and 95% of people that are on treatment needs to have their viral load suppressed. By so doing, we are achieving herd immunity, which is the reason why the rates of transmissions are very low, because we are now managing to achieve herd immunity as a country. So we are close. We are close to winning the fight against HIV.
Excellent.
All right, Doc. And then I think the last one, this one's coming from me. how would you then suggest that people have this conversation? I meet Simba is positive. At what point do you have the conversation? And is it a conversation that's had when there's a counselor, or what do you recommend?
As a doctor, I recommend people to be open with their statuses. Especially find a family member. If I tell them they are going to spread the news that I'm HIV,
tell somebody,
stigma as well. What if this relationship ends next week? They are going to go saying Knox is HIV positive. There are some social connotations to it. But as a doctor, we do recommend that people open up early, and we also recommend that we avoid stigmatization as much as possible. Let's not stigmatize people that are HIV positive. Let's accept them as part of our family members. Let's accept them as our friends. If you're hugging your friends, you can also hug someone's HIV positive. You are not going to get HIV by hugging, by handshaking.
Right.
Okay.
Let's be responsible citizens of the country. Get yourself tested, and be open about the conversations you have with the ones that you love. Dr. Maroba, thank you very much.